I'm Romesh Japra. I'm a cardiologist. Of course, I have long hours. Usually get up 6 o'clock in the morning, get my workout, have a little breakfast, and come to the hospital where usually I have scheduled patients for procedures, surgeries. The procedures mostly I do is cardiac angiograms or catheterizations, and then they may end up with having angioplasty or stenting. Some of the other procedures we do is the pacemakers, defibrillators. Many times we open up the arteries in the kidney arteries, the peripheral, the leg arteries. So these are the kind of procedures and surgeries which are usually last about an hour, hour and a half. Again, very gratifying. These are the patients who are having a lot of chest pains, has had heart attacks, and then we can take care of them without any open heart surgery. And after these procedures, in the usually morning from 8 o'clock to 1 o'clock, 1:30, if you have time, you can have a little lunch. Otherwise, you can get right into seeing patients. Usually see typically 20 to 30 patients in the afternoon. These are the patients you are following up, taking care of all their problems, cardiac problems, whether they have chest pains, angina, blood pressure, cholesterol problems, the whole set of problems we are going to be handling it. And seeing these patients after you treat them, it's again very gratifying. These patients get better, they're happy. Very few people who will not be able to get better, those who don't listen to the advice. So, but otherwise very, very gratifying. In the evening, again, go home, relax a little bit. If you have time, you do some exercise. Otherwise, have dinner. If you have any other plans, I do some extracurricular things with the social work out there or at the temple, and I'll have meetings which I'll be attending during the week, over the weekend. But that's how my whole day goes.
What time does your hospital work wrap up?
Well, like I said, about 1:30, I've finished all my procedures. In between those procedures, I'll be seeing patients in the hospital, making rounds over there, sometimes seeing some of those consultations which other physicians ask me to do. And then I have my own clinic where I go to and see these patients for the follow-up.
And what time does that finish?
I usually finish around 5:30, 6 o'clock.
Okay, so around 5:36 you wrap up your day and then you're able to go back home. That's not too bad.
Most of the time, but sometimes you have to see consultation, go back to the hospital, sometimes follow up on the surgeries, and many times if there are extra consultations, then I have to end up seeing them. And if there's an emergency patients who got admitted in the hospital, then you go see them. If anybody gets an acute heart attack in the evenings or night, then you have to come back and take care of them.
And how about weekends? No weekends?
No, weekends again we have 4 physicians, so we share calls. Then one in 4 weekends you have to be around and taking care of those patients in the hospital, making rounds, and doing any emergency procedures. But other 3 weekends you're free and make your plans.
And just out of curiosity, how many weeks of vacation do you get in a year?
Well, again, it depends. We take short vacation, usually a week or 10 days vacation, but typically take 3 or 4 times a year.
That's great.
Yep.
Well, thank you so much, Dr. Japra, for your time.
Well, you're welcome.